A 62-year-old man didn't collapse. He didn't fall. There was no accident. Instead, something quieter happened. Over weeks, then months, walking began to feel different. His feet felt heavy. Not weak. Heavy, like the floor was pulling him down. At first, it was subtle. A slight delay between thinking and stepping. Then balance became uncertain. Then stairs became dangerous. Eventually, he needed a cane, then a walker. By the time he arrived at a neurology clinic inside a hospital, he was losing control of his legs and his bladder. Something was attacking his spinal cord, and no one knew what. In a hospital setting, this pattern raises alarms immediately. Progressive weakness, sensory loss, loss of bladder control. Doctors think spinal cord disease, specifically myelopathy. The most common causes come first: multiple sclerosis, vitamin B12 deficiency, degenerative spine disease. Inside the hospital, MRI scans were ordered. The spinal cord was imaged from neck to lower back. And there it was, signal abnormalities in the posterior columns of the spinal cord. A classic pattern, one neurologists are trained to recognize immediately. Everything pointed to one diagnosis: vitamin B12 deficiency. Blood tests were drawn in the hospital laboratory. Vitamin B12 levels returned. Normal. Folate. Normal. Infectious causes? Ruled out. Syphilis, a known mimic, negative. The scans looked like B12 deficiency, but the blood said otherwise. The spinal cord was degenerating, but the usual explanation wasn't there. This is where cases become dangerous, because when doctors lose a diagnosis, patients lose time. And this man was losing function every week. The turning point didn't come from neurology. It came from hematology. A routine hospital blood count showed something odd. He was anemic. His white blood cell count was low. Inside the bone marrow, cells looked abnormal, ring sideroblasts. This wasn't a nerve disease anymore. This was a metal problem, a trace element problem, and one mineral suddenly came into focus: copper. His copper level was almost zero, undetectable. At the same time, another number was dangerously high: zinc, toxic levels. But he wasn't a welder. He wasn't taking supplements. So the question became simple and terrifying. Where was the zinc coming from? The answer was sitting in his bathroom. Copper deficiency is rare. In modern hospitals, it's almost unheard of. Copper is everywhere: in food, in water, in multivitamins. When copper levels drop this low, doctors assume one of two things: either the body isn't absorbing it, or something is actively stealing it. Inside the hospital, the investigation widened. Gastrointestinal disease was considered. Malabsorption syndromes, prior surgeries, nothing fit. So the question changed. If copper wasn't missing by accident, what was pushing it out on purpose? That's when doctors noticed something that shouldn't coexist. Copper was nearly zero. Zinc was dangerously high. In medicine, this combination is not random. Zinc and copper are enemies. They fight for absorption inside the gut. And when zinc overwhelms the system, copper loses. Excess zinc forces intestinal cells to produce a protein called metallothionein. This protein is meant to protect the body. But it has a flaw. It binds copper far more tightly than zinc. So copper gets trapped, locked inside gut cells, never reaching the bloodstream. When those cells naturally shed, the copper is lost forever. This mechanism is well known. But one question still haunted the medical team. Where was the zinc coming from? He wasn't taking supplements. He wasn't exposed at work. No welding, no industrial chemicals. So doctors did something simple. They asked him to empty his pockets. Not metaphorically, literally. And that's when he pulled out the tubes. Denture adhesive, not medicine, not a drug, a hygiene product. He had been using massive amounts, 2 large tubes every week, for years. The ingredient holding his dentures in place was zinc. And every day, small amounts were swallowed. Not enough to feel sick, but enough to slowly starve his spinal cord. Copper is not optional. Inside the nervous system, it powers enzymes that keep nerves alive. One of them maintains myelin, the insulation around nerve fibers. Without copper, myelin breaks down, especially in the posterior columns of the spinal cord. These pathways tell you where your body is in space. Without them, the legs still have strength, but no guidance. The brain sends commands, and the body guesses. Once the diagnosis was clear, treatment was immediate. Zinc exposure stopped. Copper was replaced. Blood counts improved quickly. But nerves are different. The spinal cord does not forgive easily. The progression stopped. but the damage remained. He regained some strength, but walking without assistance never returned. The bathroom product had already done its work. This case changed medicine. Denture creams were reformulated. Labels changed, but the lesson remains. The most dangerous toxins don't always come with warning labels. Sometimes they sit on pharmacy shelves, and sometimes doctors don't ask about them because patients don't think they matter. If this patient had been yours, would you have asked about hygiene products? Would you have checked zinc? Or would you have stopped at the MRI and missed the real cause? Because the next case might not be this obvious. Engage with us for more interesting stories.